All righty, guys. All right, so cervical intervention. You mind throwing that back?
But I think it would be really good. Yeah.
So I had a couple cervical spawns today. I guess we can go with this about like as far as joint mobilization, then we can do
Oh, that would be better. I like those, but I like
actual motor control training. I think those are the two big things.
So I want to.
I have started doing.
Right now,
I haven't always done it consistently, but like proprioceptive type stuff with the laser cervical spine. But yeah, where you want to start joint modes, you want to start more with the motor control stuff. Joint modes, okay. So what's the best way to do it? Want to just kind of get in and practice it, or you guys want to discuss it first? Like what we do for what, and what would be most helpful?
I think just kind of get into it.
Get into it? Sounds good.
Talk as we go. So.
Alright, so would you mind being patient, Joe?
Yeah, that's fine.
Cause I did a lot of this morning, which surprisingly, so the lady that I had a lady that had a vehicle accident a few months ago. She came back. I dry needled her last time. She came back and said dry needling was horrible, and make sure we in camera view. Yeah, she said dry needling was horrible. It didn't help her at all. She said after the pain went away, it went back to baseline. So she was stuck at 35 degrees both directions. And I just simply did PA glides. I did PA glides, I did UPA glides. And she left out with 65 degrees and like 65 degrees. Which is cool. I mean, because typically with those PA glides and UPA, I don't get as much of an improvement. Let me grab this steps through here. So Joe, let's go to your, I guess we gotta spend a lot of time on it. We just talk through kind of like the nuances of it, see if we can get anything from one another. Would you mind going to your stomach?
Yeah.
So, and you can rest your forehead on your hands. So this is my way of kind of getting them in the neutral spine position. Touch the spine. My hands are cold. And I think I showed you guys this before, but I typically just take up slack. So instead of taking up the slack to push into it, I try to gather up the tissue just to cushion it a little bit. Right on the spinal process.
Like the bowl isn't that deep, or do you wanna?
Elbows locked out.
This time?
Typically, I wanna have my chest over, but cervical spine is always low. How does it feel?
It's good.
Is it comfortable?
Yeah, the nose is a little smushy, but
Then
I
going
feel
to
good from there.
the side, yeah.
Any particular pillars there?
Now, well, in this case, yeah, kind of. I feel like you kind of own all of it anyway. I mean, I'm targeting more transverse process.
No, I think it'll be okay.
But
Yeah, the left side like
Silicone.
left side, what now?
like the when you were doing one over the other, the left was like
Sore?
A little sore.
it just felt like tighter.
No, I feel like we can get to more when we get to the. I mean, we probably get more value when we get to the upper cervical. But anything you do differently that you want to.
Do you mind if I try that?
Yeah.
I'm doing a little close in, Naomi, if you don't mind.
I've never done it this way. Usually.
Oh, really? How you guys do it?
Oh, yeah, usually face out.
PA glass?
Yeah.
So you'll go kind of. And definitely show me your way you do it. That would love to.
And there's more of a rotational mode then, huh? Yeah, that one right there,
Yeah.
right? Oof. Still, right here too?
Mhm.
All the way down.
Mhm.
What's that? What you feeling?
Just a little bit of hypomobility.
Oh, really?
Yeah. Until here. There it normalizes.
How did that feel?
It just feels like sore.
So okay.
Mhm.
Oh, yeah, 'cause my goodness, like.
Now compared to
Like, I can do.
like Naomi's place, because I noticed you were doing one hand, one thumb on it. Did,
Did
did
you
you,
do you do like the dummy thumb
So we need to
on the
really
other side?
I try to.
upgrade.
Like it felt like she was like gliding, like felt like you were getting like eye movement.
I felt the movement.
Let me get Mr. Skelton.
It's good for like the babies,
Alright.
but when I have like
You were
the
also-
bigger kids or we're working on bigger movements and stuff,
A little bit
it's
harder.
not able to be done in the little.
Maybe just demonstrating the hand
Yeah.
placement rather than the
Yeah,
actual
like,
glide.
like I felt the glide when you did it.
Well, mine is full.
It was mine is like,
Once these other kids get added up.
yeah.
I mean, I'm here on Tuesdays and Thursdays, so that really, that helps. I mean, I had, with a little sign.
So what I was doing,
I mean, like my older kids, like the treats,
you know what? I'm
and
hurting
some
my
of the
fingers.
older kids that are, able to be out of the big gym.
Right.
Yeah, I did. Yeah. I'll do it all year. Just to save the room for here.
Oh, goodness, Mr. Bones.
Okay.
This thing's been pretty valuable.
Yeah, it's been.
Hi.
But yeah, we definitely.
So would you mind getting the camera?
I mean, we do good.
Diane, you wanna go somewhere?
Yeah. When it gets crazy.
So what I was doing, the outcome, I take up the tissue, take up the grab the tissue so it can be a little more cushion there, and then I'm going straight down like so.
Mm-hmm.
Then I'm on each one, but then when I go out to the side, so I'm right here. So it's enough room for both of my thumbs to kind of get in there. So yeah, kind of articular pillars and transverse process. Then I come, and then I'm just working my way all the way down. I go PA glide. Sometimes I work PAs all the way. Then I go UPA, just going to the next segment. But I found that, like in the way you doing, I used to do it like that a lot. It just started hurting my thumb so much. Just that pressure.
Right.
So what I'm trying to do is brace my thumbs on top of one of those to try to keep them straight, to save these joints right here long term. But you guys say you do it the opposite way?
I'll do it supine.
Oh, okay. Somebody called? Oh, it stopped recording, I bet, huh?
I don't know.
I'm sure it did. That's okay. All right.
It's like the sea.
Do you guys? You can put the camera back. Thank you.
I do. Or I really like the rotational modes and supine.
Oh yeah. Let's try that.
Those are my favorite.
I love the I just didn't do a lot of those. I do them. I didn't do a lot of them, so I'm not as. I gotta think about it a lot. I gotta think about it a lot when I'm doing it. Figure out what I'm trying to do.
There we go.
What's the rotational? What is that?
Well, it's like an upslide. So if I'm here, I like to use a rotation and pull it up. Because your facet joints are at a 45-degree angle, so I kind of pull up at a 45-degree angle just to open up that space a little bit. You don't have a lot of that.
It's really not. Yeah.
She ordered them. She had them in that room, so it must have
So
been.
you're like,
But we do have fidgets.
So I'm more, like transverse process here.
okay.
I'm like feeling for those facet joints.
Better be in
So
it.
I'm just kind of.
Yeah, he ordered fidgets, but we only have the one thing of
And
it.
you have
so
to think
two
about
people
moving
can be in at the same
segmentally.
time.
There you go. So I shouldn't have you in full rotation till I get up.
It would probably be good to have an extra.
Yeah.
diameter one.
Any tenderness in any of those?
Not too bad.
No, that's-
Okay, so you're just kind of pulling up.
Yeah, so that like 45-degree angle.
Yeah, like the higher you go,
We
the
got 'em.
probably more tender.
We've been using them.
So that would be synonymous to like a UPA.
No, it's
Yeah.
like a. I don't know. describe it.
I mean, what you're trying to reproduce or what you're trying to
A
work
little
on.
bit, right? Because with the UPA, you're getting
Mhm.
this, right? And that's what I'm going for too.
Okay, yeah. So someone's limited in rotation. This is when you would go to this.
Absolutely. Helps with side bending too. Just
Side
because you're
bend.
opening up that, you're like stretching the joint capsule
Okay.
to when you pull it open like that. Glide it up.
Cool.
Mhm.
What other like general modes do you do in the neck?
New distraction?
Okay. So let's see your distraction. How you do it?
You okay with this, Joe?
Yeah.
Alright.
So amazing.
I'm just gonna. I'm getting your hair in there. Just kind of my body weight. And I'm trying to keep my hands as soft as possible and just kind of cup the occiput.
Chris, can you just show me the difference? Because I've been actually using the one that you showed me,
Mhm.
the arm, and then just so I can feel
Oh, okay. You
what
feel
you're
the
doing,
difference.
so I know it's right.
Okay.
I don't know if he showed you this one.
No, I want to see this one.
It's been helping a lot.
Yeah?
That's not
It's
gonna
like
stay.
I'm not
You mind
gonna
holding
get
this?
an accident.
Yeah, I mean, just opening things up for people.
Could you hold it? Right? It's.
Okay, yes.
Thank you.
Hold it down like this.
Because you said you like curl your arm.
Yeah. Well, so I'll lift your head from me. So I'll start with my hands supinated, and I will stabilize their head because if I don't, it's not gonna get the full traction. And then I start to slowly pronate. That depends on how much traction I need. If I'm not getting it, then I'll start doing some elbow flexion. But are you feeling anything there? Not much.
So now you're adding elbow flexion? Because I feel more now.
Yeah. My biceps kicking in.
Okay, what would it be with elbow flexion?
Well, that was.
Oh, that was, okay.
So just pronation,
Okay, is that?
like if I add,
I see. Okay, yeah, I feel the difference.
yeah.
Yeah, they feel pretty similar.
Mm-hmm.
I'm working a lot harder though. So I couldn't sustain that too long.
I can sustain mine for a while because I pull my seat or push my seat back.
Right. So that's why when I do this, when I'm doing this, I don't do it for someone that needs a lot of force. I do it for that very irritable patient that just needs a little bit.
Gotcha.
Yeah.
Okay.
So when I
Like
do,
that one that I asked you about.
Yeah.
Yeah, yeah. Okay.
when I need some force, I get the belt, and that way I can just kind of rest back there
The
for a second.
belt.
Yeah.
You use a belt around the neck?
Yeah.
Well, not around
Well,
the
around
neck.
around-
Not around the neck.
I don't see that. What? You see that belt?
I think mine might be in that box right there, the gray
Is it
one. Take a look. I think so. No? Where's my belt then?
I had mine earlier. You gotta put it over.
I see one right here.
Oh, there's it. That's it. So yeah, I would use
Do you need a towel or something? Or you use your hands?
No, I use my hands. I usually. It really depends on what mood I'm in, and person's head. What's funny? But that I use the belt.
It's just
Yes.
the mood. And
Oh yeah.
What am I doing?
Lift your head. Alright, you get nothing.
Okay. I get the belt.
So I can rest here all day.
It's just the freezing. Okay, so, alright, so.
I told one patient I was about to do a mole. I said, I'll give me a
Okay,
second,
I'm
I'm gonna
not
get my
gonna
belt.
This is
Like
the
sounds
best.
like my dad. That's it. And this is like
Yeah.
I can rest here for 3-4
This
minutes
feels-
if I need to.
Phenomenal. I'm going to have to
This
try
feels
that.
amazing.
Get in the,
The belt is the way to go.
Oh goodness.
Let me
Well,
check.
because you also
Yeah, because
get like a
feel
little
like,
anterior movement
Oh,
too. Yeah.
Yeah, and if you get too much, you can kind of.
Like a little-
But I feel
so,
Yeah, with a
Yeah.
little bit of extension. Look at that
uh,
in the upper cervical spine.
but you can pull pretty hard with it, so you gotta be careful with it.
Really?
Because all I'm doing is leaning back. My body weight is doing all of the work.
and the belt is just sitting like right.
You wanna try?
Yes, he's actually.
That was, yeah. I think between the three,
Yeah, that's it.
that's it. Because it felt, I feel like yours had more force, which is better than this one. Like this, like you said, is good for the irritable ones.
Mm-hmm.
But between yours and the
And the
belt,
belt?
I think the
Yeah.
belt, also mechanical, like I think it'd just be easier on your body.
Yeah,
Right.
we would.
Okay, so this.
Yeah.
Okay.
I'm ready.
You're ready.
Ready for the belt.
You may have to. The biggest adjustment is the height. I mean, the length of the belt. You know, just kind of figuring out what works for you.
A little bit.
So you should be able to just lean back.
Yeah, because it feels like you're still holding the belt. It was just.
It's too long for you.
This is too long
Uh-huh.
for me. Okay, try not to hit you in the head with the belt. Let go. You're good. I promise I won't.
Yeah, because you want it kind of close.
Mm-hmm. Somewhat. Once you do it, you'll kind of get a feel for what's comfortable.
Yeah, sorry. There you go.
Put this back on.
How long?
Okay, so I split that
Here.
only because there's so many holes.
Mm-hmm.
You gotta clean them out.
Oh, yeah, I mean, you have to wash it with some water, I think. Yeah.
But I thought about those,
That's
cause
what I
like
do
for
with
you
my
guys.
alpha ones, I have one, we used to, to put like marbles in the holes,
Was he holding my hand?
yeah,
Yeah.
yeah. I've been using it with Luca, he
That's
does
it.
math, so we do, math with those too.
That's yeah.
Are you doing oscillation?
No,
I feel like it feels better when you just hang.
Well,
I can feel that all the way down into my shoulders, like between the shoulder blades.
I would do like all the way off, all the way on type of thing. But not
Don't wanna spend the whole session doing that.
So do you do it with the towel as well?
That's easy, you know, soap and water,
Okay.
rinse it off a little bit and good to go.
You'll be an inch taller, Joe.
Oh, downtown.
Oh my god, it feels like it's just like decompressing everything.
Oh, yeah. How far do you slow it down to? Like the lower cervical?
Yes,
Oh my
the
God.
No, like in between like
Oh, really?
upper thoracic, yeah,
They're really going.
which is exactly where it bothers me.
And now that's what the kids want.
Yes.
That's all they want. I'm like, okay.
One of my criticisms with like the last place I was at, postural restoration techniques, is
Right there, making it.
they don't necessarily mean to be, but they're super flexion based versus extension based.
Oh, really?
And I think I accidentally like overdid it, and ever since, I don't know, like I never used to have mid back pain, and then I started working at that PRI clinic, and like, yeah,
Definitely feel it.
yeah,
Could
that's my one thing with postural restoration.
Could be the birthdays too. This past month.
Oh,
The what?
goodness.
The what?
Said
The
could be
birthdays, he
birthdays
said.
This past month. Getting a little older.
No,
That is not it.
because the neck's gotten worse, but
Oh, really?
yeah, mid back has not been like an issue. The
So
birthdays,
Yeah.
32 is
When's your
ruined.
When's your birthday?
April.
Oh, okay. Alright, so I try to get over the mastoid and pretty much right underneath the occiput. And then I bring it together. If I can see their eyes, then it's probably going to slip. So I bring it all the way in together. And I keep I've learned that if I have my elbows out too far, it's not going to pull right. So if I keep my elbows in, then I just lean back. How's that?
Yeah.
Good pull?
See, now I'm like, is that better than the belt?
Then this is kind of effortless too, though. But I think you can sustain a little longer.
So the elbows are like this?
Uh huh. Yeah. Like my
Well,
elbow.
his elbows are in his side.
Yeah, yeah.
Like
that's-
They're
that.
tucked in, yes.
And then you're just leaning,
Just lean back.
and it's just kind of cupped,
Where he's in a staggered stance position.
like the towel is folded in half, and then just.
No, it's not even folded. It's like this.
He's just holding.
Like
Oh.
you can fold it.
Oh, okay.
It really doesn't matter. See how this feels.
Yeah, it's super helpful.
I mean, you go into a lot of extension though. Let's see.
Yeah, she was going into a lot
I think it
of
was better the
extension.
first time.
That's a good thing.
Probably better grip because there's less padding.
Yeah.
Yeah, I think it was better when it wasn't folded.
You want to try? You want to try the belt at the top?
Yeah, sure.
You want to do
Oof.
that?
Yes,
I
I'll-
coach you. You okay?
Yeah, I just got like.
A little lightheaded.
Yeah. Pull it on the neck.
Proprioception.
Yeah, that is.
It would be great if
That
I
is my
find
vestibular system.
find something to edit this out.
Well, a lot of dizziness can come from C-spine. So if you get someone who has
Those-
vestibular
Those
problems,
tracks run right there.
it can actually, you have to treat their cervical spine,
Yeah.
or you you may
Yeah,
want to treat their cervical spine as well. Alright.
Alright, so let's start with the towel since you're holding the towel. So you said it was,
So I use the
so then the
silk
edge
to-
here
Mhm.
is just where?
Kind of here.
And then you said, like this?
And I'll go in the stagger stance, elbow tucked in, and bring the towel in closer, and then you just gradually lean back. There you go, perfect.
Like
How
that?
does it feel,
Can you
Lane?
feel that?
Feels good.
Yeah, it's like
Too much?
like it's the same thing.
So the only thing we gotta be careful with is, it seems like yours as well, Naomi, your cervical spine goes into extension. Really, just your upper cervical goes into extension quite a bit. So I think if they have a lower cervical issue, this will be fine. But if they got an upper cervical problem, then
Is that better?
you may not wanna do that.
Well, now I feel like you're rotating me a little bit
Like
to the
here?
right.
Oh, okay. Versus just pulling straight back.
Yeah.
I think two hands are good though, as long as it's like mid cervical spine and down. Cause the
Like that?
yeah, that looks good. Cause I take that back. It's not the cervical spine and extension. It's just like it's the upper cervical, not the whole cervical. Yeah, that
Feels
looks
good. Yeah, it feels nice.
Mm-hmm. Alright, and then the belt.
How did that feel to
The
you?
towel's like easy, it's just like, yeah.
It's all in the setup.
Belt.
So it's over. So the other way. Hold on. You can go ahead and clip it,
Okay.
and then you put it over your shoulder.
Over my shoulders.
Yes.
So it's like so.
Like this?
And then your
Yeah.
hands go in between.
No.
There you go.
With it over your
Yeah.
shoulder.
There you go.
Like that.
That may be too short for you.
Okay. And then, like a little, oh, this is not as good.
Yeah, it takes a little weird. It takes a
Yeah.
little while to get used to it. It's a little weird.
Oh, wait, I gotta put this under.
Yeah.
Sorry. I will 100% not be using the belt. I like the towel.
Yeah.
Towel's way easier.
Alright, so now we can move it.
Okay. And then you just tighten it up.
And so the towel is like, I mean, the belt is right on the back of your hand.
Oh, yeah, this is. Oh, there we go. Wait, no. For me, they felt. Yeah, I don't like this. Just for me, I don't like this nearly as much.
That looks good. The only thing you gotta play around with is the length of the belt. Let me show you real quick.
We'll be going with the towel.
Yeah. And I felt like with this one, you're grabbing on to.
I just felt
Give
like the
my
towel was
jawbone
so
a little
much
bit.
easier.
Mm-hmm.
The towel's easy.
Mm-hmm. Depending on my mood, I'll get the
Yeah.
I was like, what? Feeling very DV. Oh, I see, okay.
Yeah, so I do this first, and then all the patient has to do is find that. You gotta be careful about the earrings, but is that hurting your ears?
That's okay.
I probably will be. I'm trying not to squeeze the ears. I'll probably be gripping harder.
What feels better?
Feel traction?
Like I thought they felt about the same, but I think the towel was more comfortable. I don't know. Like it's nice. Like I think the towel from the
Yeah, I did
therapist.
feel like my earrings hurt. There was a
Yeah.
lot more pressure on
Yeah.
the side of my head
Yeah.
with that one. Although it did feel good traction though.
But it's
Yeah.
just different tools in the
Like
toolbox.
on the table, that feels great. For me, I feel like I'm too tall because we don't have high-low tables.
Right. We will soon. We're supposed to.
Oh really? Yeah, I felt like I was kind of like leaning over,
Yeah.
but the towel I could just lean right back and like had good grip on it because it wasn't slippery.
So let's go upper cervical.
Okay.
You okay now?
Yep.
So let's just say we were assessing it, or let's just say they had pain on the left suboccipitals. If I determine to have stiffness there, I may assess it. Boom, okay, you're good there, good there. But if I found that she had some stiffness on either side, I would put in rotation and my hand, my two fingers here are literally right on her that's your master one. So it's just the occiput, right by the suboccipitals. And by the time. Would you mind folding the towel up there?
But like, this way?
And then I'm gonna go on her, you can fold it a couple times.
Or more?
No, that will. So now you should feel like a distraction. So this one looks horrible, but it's not. It's actually pretty good. Looks like you push in somebody's face.
I feel that on my left side here. That's where it's pretty good.
And then you just on this bone, which I can't think of the name of it right now.
Which one?
Facial bone.
And it was quick working, but then they have to close and then they have to do.
Like the masseter?
Big hit. It works really well.
No, it's just the maxilla.
Maxilla, that's it, yeah.
Look, they even got one that
It's like,
doesn't use it.
that sounds like a muscle.
But yeah, this is one of my upper cervical go-to.
Really, I like this one. I can do my other side.
Yeah, even it up a little bit.
Yeah, we need you to show me how this feels.
Amazing. Okay.
This feels amazing. This is the best mentorship we've done.
Hey, I'm not doing a lot of force at all.
No,
You get a pretty good stretch.
and I feel it exactly where I think I should. And that's really the only place I feel it.
Do you feel it different side to side?
Not really, they both feel really great.
Alright,
You
let
want
me
to-
say.
Huh?
I gotta take it for a spin.
You want to do it, Naomi?
Well, yeah, show me how to do it.
Um,
Well, first, let me do kind of the assessment. The assessment was the least fun part.
This is one that I know of a bunch of patients that'll be locked up in like C1, C2, and I don't know
So
what
you
that
did
is.
full cervical flexion as far as she
oh,
goes.
yeah. As far as she has?
That's, yeah, well,
Oh, man, Joe. You look tight there.
Yep. My neck is like,
hold on, let's go this way.
That's uncomfortable, Joe?
yeah, it's locked up. It's my C1, C2 does not move.
Yeah.
Alright, so you have the towel.
And then I'll go, then you just take her,
Was it folded up like this?
yeah, well, either way, you just want to get a little cushion. Just you want pushing directly in her face.
So right here.
Can you rotate it?
Mm-hmm.
So my fingers on the other side are right here.
Just pure rotation.
Okay.
No, not this. This is your mobilizing force. You'll be on
I know, but I'm just trying to show you because
on
you
that
can't see
side.
my underside.
Yep,
Like I'm behind her SCM there.
Right.
And then I'm just,
And you know what, Naeem, I kind of do a little bit of pull too. Not, I mean, just barely. Everything I'm doing.
how you doing, Joe? Tender? I want you to feel Chris do it. Just to see if
It's
it's.
my eye.
Yeah.
wait, let me see. Let me see. Just for like compare. I'm like, okay.
What
So,
was your eye?
Yeah. We can like put like.
okay, so this hand is on like the base of the occiput.
Right.
And then my two fingers are right at that little
That's
lateral.
something that parents
Lip.
always forget to do.
Yeah, I don't know what you're talking about.
And that's easily, you can throw it in the washing machine or spray it down or.
Okay.
Oh, I see what you're talking about. There's one
feel it right
right
here?
there. With pockets.
And that, well, I'm not pulling as much. Sometimes I
So
do.
you're kind of like pushing and then.
Well, to be honest, what I do is I'll take up the slack here more than anything. Then I maintain it, then I'm just pushing gradually.
The ones
I'm
you
talking
push
about
out,
like it would be a grade 1 on the shoulder. You know what I mean? It would be
Yeah.
I
barely
don't know
pushing
how,
on
what
there.
they.
Do you feel it there, Joe?
Yeah.
There's a kind you can. Spray.
You mind if I try it again? I'm
Yeah, you
gonna
want to do this side?
try. Sure, let's do this side.
Alright, so slack. Rotate. Mhm. Yeah, you got it.
Got it. Good.
Yeah. Because I think you're distracting, and then
Mhm.
like, yeah.
So I guess a prereq, but they just have to have enough rotation to be able to do it.
Yeah. It should help with rotation though, right? I mean, if you do it.
It should. I mean, it should. Well, I guess they gotta have enough rotation coming from C3 down.
Yeah.
Because that's what you're doing. You're between C1 and C2.
That's what you're assessing, that rotation there.
Okay.
Well, like even if someone had, if they didn't like dry needling and I couldn't dry needle or suboxyl, I would do this one, or I would do oh yeah, go ahead. I'll show you.
Yeah, you want to just.
No, go ahead. I'm sure I'll show you a different one.
Oh, okay. Can I just try this one
Yeah,
real quick?
absolutely.
Just because it would be so helpful for me. Right, so
Yeah.
coming under.
Yeah. Do you want to assess it first?
Yeah, and then. Oh dear.
No. Do full.
Oh,
So
like
that
all the
you're
way.
locking out the C spine. So that the only thing. Okay, we're so
Sorry. Sometimes I do that with patients. And they're like, what?
You can imagine my therapist saying, "Oh, dear."
Oh dear.
Yeah, so you lock out the lower cervical,
Right.
then you. They should have 45 degrees each direction.
So kind of be able to talk about that, any cases that might be a little bit difficult, or, you know, we gotta work on goals.
So then I'm on the lip here, right? Take my towel. And then where am I pushing?
Just kind of in this region, not just making sure you're not on her temple area. Just on that jawbone.
Are you still homeschooling the kids? Are they?
Do you feel?
Good. Yeah?
Yeah.
You like it?
Yeah. They're doing well.
That's good.
Okay, cause I was like,
feel that?
Sherman said,
Feel the same?
yeah, we're thinking. Yeah. I'm like, so I was doing it
It
with
doesn't
back
feel
in
as
school. Not if you were
exact.
homeschooling.
I feel a little bit more of a muscular stretch.
They get like 2 days at the end of the night, so we had time.
So
So are you doing like a program through us? or
take up the
like
slack.
academy or
Well,
something? Okay,
well,
so they can kind
well,
of
that's fine.
set it all up for you. Yeah, so I don't
Yeah.
have to do like.
Although.
Somewhat, but I don't have to come up with the lesson plan.
I think
Oh,
well,
yeah,
you don't have to
yeah,
necessarily
yeah,
cord
so they
ahead.
have that,
So
and
when
then
you let me
Are
see
you usually
something.
sitting when you do this, or no?
No,
They
no,
do
no, I'm
online
saying.
lessons for like the 4 subjects that they log into.
So now you tell us the difference in the setup.
See, because I was gonna homeschool.
I'm right here.
Yeah, yeah. So I'm gonna just sit there and do the lesson plans and everything.
I think it's my bottom.
I think your bottom hand was more like this. You were palpating that when you were more there.
Oh.
So kind of make sure that
Oh,
you're.
they'll say, how are you even? No, that was my one thing.
This
I
is
was
no,
like,
no.
I gotta take that.
Right.
And still doing supervisory,
Yes.
and do all that, I can't, I was something at that, yeah. So, we are doing, but.
Then make sure she's not too much
They actually,
extension.
like, Taylor wants to do it
Oh,
again.
there you go.
Oh. Yeah, I don't know, cause she'll be, next year she'll be 8th grade, she's 7th grade now.
Well, for you, you stand up tall, lock your elbow out. Then just give a gradual. Well, you may not be able to lock it all the way out, but that's good. That looks better.
But she did it herself, and it wasn't where she had to do like the lesson plan, it wasn't that great.
That was
And then she sent her back to school for a year, and that didn't work out.
Let me see.
So
Okay,
then
yeah,
she
it was
threw
too
but
like
she just threw,
here.
like,
Okay.
How was that force?
The force? It was good. Maybe a little bit much, but.
I think you had larger amplitudes. Like you were going down, you were coming back too
Okay.
much. You just gotta stay kind of. Yeah, like grade 1. I would even say grade 1,
Yeah.
like small amplitude.
They're like in different states,
you okay?
like going around, yeah,
Not that one.
yeah.
Yeah,
See, that's
well,
actually,
actually,
yeah,
I have like a-
yeah. I think that's a great way to learn, cause you get to actually see,
I'm like really bothersome.
so I enjoy it, because then we can find out.
Right behind it, right
Right.
behind where Baker system is.
Mhm.
You got one bowl. Yeah.
Right?
You see the other side.
I think we are. Summer's probably talking.
Oh no,
It's hard to tell, right?
it's not that permanent.
Oh, yeah.
Yeah, I wouldn't say.
But we did have.
Turn this on. That was a good session, guys.